Hello, Assalamu alaikum wa rahmatullahi wa barakatuh. Today we are going to talk about a different topic. So I said in my previous video that we could see a wide variety of people in our medical facility or medical experiences. In our medical experiences, we could see a wide variety of people. Sometimes we can hear a wide variety of stories, life stories from the people we meet. So today's topic came from one of my those experiences. So limerence. I don't know whether you all heard about the term limerence. So in simple means, let me ask you a question. Do you ever feel like you have an obsessive thought about a person? Like if you think about a person constantly, or that person comes to your mind whenever you work, do something, or sit alone, or without doing nothing, or while you are driving, or something like that, or while you're playing, driving, or that person, or anything, when you do something, that person comes to your mind, or you have a thought of that a certain person, and it comes to your mind whenever you want it or you don't want it. Have you ever experienced that feeling? Yeah, I'm talking about that feeling, that obsessive thought of a person. Let me rephrase it. I'm going to talk about that feeling or that thought which you may mistakenly thought it as a crush or something like that. That is I'm going to talk about today. The feeling of limerence, and or I'm first going to talk about the feeling of limerence, and then I'm going to differentiate it with a crush. What is mean by crush, or what is a crush, and how the crush differs from the feeling of limerence. So limerence is a psychological term that describes intense form of romantic attraction towards another person. It is way more stronger and more consuming than a typical crush. Let's look into the key features of limerence. The key features of limerence include one, obsessive thoughts. The person constantly, or you constantly thinks about the other person. It is called limerence effect. These thoughts can become more intrusive and hard to control. The second one is emotional dependency. Uh, your mood strongly depends on how the other person responds, or how the other person reacts. Small signs of attention from the other person can cause extreme happiness in you. Or in other words, perceived rejection can cause deep sadness. Number three is idealization. The person tend to see, or you tend to see the other person as perfect and ignore their flaws. Now, the first is strong desire for reciprocation. The most important need is for the feeling to be returned. Now, the next point is feeling of fear of rejection. Even minor sign of rejection from the other person that you are idealized can feel devastating for you. Okay. Now let's come to the next point: physical symptoms. Rapid heartbeat, nervousness when you are near that person, difficulty in concentrating when that person is around you, or daydreaming about that person. Sometimes you may get sexual fantasies or sexual thoughts about that person. Now let's look into what are the difference between limerence and the love, the feeling of love. Limerence is feeling as obsessive thinking, while the healthy love is balanced thinking. In limerence, you idealize the person as a perfect person, and Uh, Let me say this, that it's your brain making up the stories, or your thoughts, what you want that person to be, and you create a story about that person, or the person you are attracted to, and your brain makes you view as a perfect person according to your thoughts. So you idealize the person. In limerence, you idealize the person. Whereas in healthy love, uh, you accept the person as it is, like accepts that person's strength, and as well as the weakness. So in limerence, you may feel emotional highs and lows depending on the reciprocation of that person. But there is an emotional stability in healthy love. In limerence, you focus more on getting back the love you feel for that person. While in healthy love, focus on caring for each other. Okay? How long it lasts? The limerence lasts usually from 6 months to 3 years. Okay? It often fades when the feelings are clearly reciprocated and become a real relationship, or when the person realizes the attraction is unrealistic. Okay? So important note is that limerence is not a mental illness, but it can feel overwhelming if it interferes with your daily life. Okay? What is the difference between limerence and crush? In crush, the intensity is mild attraction. About the thoughts, in crush, you think about that person occasionally. About the emotional control, the feelings are manageable in crush. And in idealization, in crush, you like the person, but still you can see the flaws. Okay? And duration of the crash is usually short, in within weeks to few months. It will fade within weeks to few months. Effect of the crash in daily life is, usually does not interfere with the work or your routine. The need for reciprocation, you may feel nice if they like you back, but not essential. Reaction to rejection, you may feel disappointed, but you can move on after some time. But it is not the case in limerence. You need a more time moving on in the case of limerence. Let's look into some simple ways to understand what the difference. In crush, you can say, I like this person, it would be nice if they like me too. But in limerence, I cannot stop thinking about this person, my happiness purely depend on them. Or you may feel, I cannot live without that person. Okay? For example, you may feel happy seeing someone you are having crush on and enjoy talking to them. But in limerence, you constantly analyze every message, look for hidden meanings, and feel extreme excitement or anxiety about their responses. Let's look into the psychological view of limerence. Limerence is often driven by dopamine, uncertainty, and emotional longing, which can create a cycle similar to the addictions. Now, let's look into how to manage the feeling of limerence. Limit your contact with that person or social media checking. Focus on hobbies and personal goals. Talk openly with the trusted friends. Practice mindfulness or journaling. Sometimes therapy helps if the obsession becomes disturbing or distressing your daily needs, your daily life. Okay? That's the end of today's topic. Let's meet in another video with another topic. Thanks for watching. Assalamu alaikum wa rahmatullahi wa barakatuh.